Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with important MCQs. Who all have visited first time on this channel, please do subscribe. We'll start with the first question. The weight of placenta at term is? Right option is C, that is 500 gram. Next question. The hormone mainly responsible for uterine contraction is? Oxytocin. Next question. Chadwick's sign indicates? Right option is A, that is blue discoloration of cervix. Next question. The normal weight gain during pregnancy is? That was 11 to 13 kg. Next question. The presenting part of fetus in breech presentation is? Right option is B, that is buttocks. The average duration of third stage of labor is? Five to 15 minutes. Next question. Which investigation confirms pregnancy earliest? Blood test for HCG. Normal time for involution of uterus is? Six weeks. Colostrum is rich in? Vitamin A and antibodies. The commonest cause of postpartum hemorrhage is? That is uterine atony. Lochia rubra normally lasts for? 1 to 3 days. The commonest site of ectopic pregnancy is? Fallopian tube. Supine hypotension in pregnancy is due to compression of? Inferior vena cava. The period of viability of fetus is after? 28 weeks. During pregnancy, the total blood volume increases by? 30 to 40%. Hyperemesis gravidarum means? Excessive vomiting. Normal duration of puerperium is? 6 weeks. The hormone responsible for maintenance of endometrium in pregnancy is? Progesterone. A pregnancy occurring outside the uterus is called? Ectopic pregnancy. Ballotment is a sign detected by? Palpation. Normal umbilical cord contains? Two arteries and one vein. Hydramnios means? Right option is B, that is excess of amniotic fluid. Next question. The latent phase of first stage of labor lasts? Six to 8 hours. Fetal skull sutures allowed? That option is B, that is skull molding. When head is visible at vulva without receding, it is called? That is crowning. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.